Sir, you are audible, sir, and we are live in YouTube and Zoom also, sir.
Okay, fine. So good evening, everyone. Once again. So we have already a little late, so because of some technical issues. So I welcome you all on behalf of Metier team, and already we had a session day before yesterday. So that session, those who have not seen, you just have the look. What about the courses, detail, and everything? So we've given all the details and what questions, how it will come, and the schedules, course detail, 35 days study plan. இதெல்லாமே already we have discussed. Okay. So what I focus today, many freshers are there. So you should know the content, how to prepare, how the MCQs will be there, how you are going to prepare any topic. If you take any topic like GI bleeding, today's example, which I have given the example with the content with MCQs, GI bleeding. So இந்த மாதிரி தான் இருக்கும் ஷார்ட் டேர்ம் கோர்ஸ் வந்து இட்ஸ் அ பேட்டர்ன் ஆஃப் ஸ்மால் எக்ஸாம்பிள் ஹவு த ஷார்ட் டேர்ம் கோர்ஸஸ் டிஃபர் ஃப்ரம் தி ரெகுலர் பேட்ச். ஓகே, ரெகுலர் பேட்ச்ல வந்து இட் வில் பி டிஃப்ரெண்ட் அண்ட் ஷார்ட் டேர்ம் கோர்ஸ் எக்ஸாம் ஓரியன்டட் பேட்ச். ஸோ highly importance we always give more important exam before the exam, the course which is happening before the exam, so that will boost the students to crack easily. Today I prefer this topic. So you see that in the topic how the questions can come, how the content you have to prepare, and what all the important part which we have to focus. Even though everyone knows GI bleeding, okay, GI is bleeding, esophagus bleeding, or it may be the cirrhosis of liver, which is a cause of one more cause. So ஒரு idea, maybe you may be having some idea about GI bleeding. So GI bleeding வந்து mostly when you think about GI bleeding, we can create maybe 25 questions, maximum 50 questions also, right? So adla what is more important, that is you have to be very clear in your exam. First, people are aware of the GI system, how the esophagus and the stomach. So basically some basic idea about, you got an idea about, this is the distal of esophagus, this is the proximal of the esophagus. GI bleeding in a way, gastrointestinal tract. So you know that gastrointestinal tract fully it will be esophagus, mixed stomach, and completely. So when the bleeding starts from here, so this bleeding usually when it starts here, usually it goes to the stomach also, and then it goes to the intestine, and then come to the rectal anus, and it comes at a you know that hematochezia, hematomyces, hemoptysis, many words which you may be studying in your fundamental. So இப்போ நம்ம படிக்க போது GI bleeding, gastrointestinal bleeding, it may be from esophagus, upper GI, UGI, or it may be LGI, lower GI bleed. So it may be upper GI bleed or it may be lower GI bleed. So how you are going to differentiate? So இதுதான் வந்து உங்களோட idea how you are going to rule out the bleeding. Even though we are in the bedside, when you turn the patients of positioning, when you're changing the diaper, or when you are when the patients complain of bleeding, so when you are in bed making and all பண்ணும்போதுலாம் usually bleeding இருந்தா நீங்க பாப்பீங்க. So that bleeding may be initially you have to assess it's a fresh bleed or it is a old bleed. அதை பேஸ் பண்ணி தான் you get a question practically. Fresh bleed na you know the bright red, old bleed na it may be dark red. So இதெல்லாம் வந்து ரொம்ப important. Fresh bleed ல name is different. Where the fresh bleed will come. So if it is bleed from your upper GI tract, so what does it mean? If bleed from lower GI tract, what does it mean? How we are going to manage? And 10 MCQs I added here for the interesting, so that you people are able to easily you are able to attend the questions in the GI bleeding. So when you when you think about what is the scenario which usually clinical scenario is always important. Yeah. So you see that a 45-year-old male present with emergency department with concern of 2 days of black stool and light-headed sensations. Where is the bleeding from? What are the key emergency intervention by the nurse? So practically, நீங்க வந்து ஒரு ஜெனரலா ஒரு விஷயத்தை GI bleeding. அப்படின்னா GI bleeding. Okay, what is GI bleeding? Okay, 2 days before ஆச்சா, when it happened, patient having black stool, and what may be the reason, where the bleeding is coming, and how we are going to intervene. The role of nurse is always important. How we are going to intervene this? Yes. So people, those who are good in the theory, they may be knowing. Some people are answering it's from upper GA bleed. Is it from upper GA bleed or lower GA bleed? That's very important. Fresher mostly people are already who's having experience. They may be writing the clear basic. So it's maybe from upper GA bleed. Yes, upper GA bleed na you know very clearly upper GA bleed. And what you do immediately. So inge pathina you get two questions. Basic questions. The black stool 2 days you are assessing, and the bleeding from the source black stool dark color always from the upper GA bleed, and lower GA bleed is a bright red. So that's the difference which you should know. And what is the management intervention? Start with airway breathing, and ABC is always the priority. How the patient's airways pretend. So based on that, we have the division of bleeding, upper GA bleed and lower GA bleed. So here, people are giving the right answers, upper GA bleed, good. So maybe you may be having good knowledge about GA bleeding. So this is what I said. Basically, the division of upper GI, you can see that upper GI till your duodenum, sorry, with the pylorus comes, and then intestinal fullaway it comes under lower GI bleed. Okay, so basic things which should be very clear. How the food, how the bleeding comes, distal esophagus, and come to fundus, body of the stomach, and pylorus. Then it comes to duodenum, and then entering into this intestine, small intestine, large intestine. So basically, the differentiation between upper GA bleed, you are going to find out what is the cause of the upper GA bleed. Questions வந்து இப்படியும் வரலாம். The nurse is assessing the patients with upper GA bleed. Which of the following is the cause of upper GA bleed? அதனால தான் வந்து எந்த ஒரு slide, if you whatever slide if you are preparing, notes if you are preparing, this is your competitive exam. You have to focus only how the questions will come in your exam. If BS nursing, you may be write the story of 10 marks and 5 marks. What all we need, we'll write. But here, any slides which we do, always we give importance to the questions, MCQs. Even this is a slide. I may tell what is the cause of upper GA bleed. You may be telling it is peptic ulcer, erosive gastritis, or esophageal varices. Then I can go for second slide. That is not applicable in your competitive exams. What you study. And many people are lacking behind to prepare the competitive exam skill. You have to correlate and compare. If it is upper GA bleed, I put a slide, what is the cause of upper GA bleed? Here itself, you have to decide the question, what kind of questions will come in your competitive exam. So option வந்து நிறைய இருக்கும். So you write many people, the four primary reason for the upper GA bleed, it's a peptic ulcer disease, esophageal gastritis, esophageal varices, and Metier syndrome, where the lining of the esophagus get damaged. Okay, so இதுதான் வந்து basically, so I may put a question, the nurse is assessing the GA bleed. Which of the following is upper GA bleed except? இங்க பாருங்க questions வந்து how questions they will ask. Anything they can ask. So I put a question, the nurse is assessing the patients with upper GA bleed. Which of the following is a cause of upper GA bleed except? So இதுதான் வந்து உங்களோட idea how to prepare the competitive exam. Two way people are memorize பண்ணி causes of upper GA bleed, peptic ulcer disease, esophageal varices. Sincere நம்ம memorize பண்ணி ஒரு பிரயோஜனமும் இல்லை. Okay, it's not possible that if you memorize everything, you frame the questions yourself and think about. This is the example which we teach, and you have to correlate. நாங்க சொல்றதை வந்து you have to analyze yourself and you have to compare. Okay, we have studied the upper GA bleed. What may be the cause of the upper GA bleed except? Which of the following select all that apply. I may give option 1, option 2, option 3, option 4. Now I come to answer A. 1, 2, 3. Option B, 1, 2, 3, 4. Option C, 1 and 2. Option D, 1 and 4. இப்படியும் வரலாம். This also can be happen. This is where we are lacking. This is where we are lacking. சும்மா நம்மளும் படிச்சு people are studying, memorizing and going. It's not possible if you are studying all the books and clearing. உங்களுக்கு வந்து என்னைக்கு how you are comparing and correlating the questions. Okay, GA bleedல இந்த மாதிரி questions வரும். You decide yourself. Your graduation of 4 years of BS nursing, உங்களுக்கு ஒரு idea தான் we can give. But every content you decide your MCQs. It may be basic questions or it may be tough questions. So I can classify Upper GI bleed, everyone is telling esophageal varices. Okay, that is a very basic question. Or all India full over 80,000 people are writing the exam. Nearly 70,000 people will write upper GI bleed, esophageal varices. அதில் உங்களை சேலஞ்சில் இட்ஸ் நாட் சேலஞ்சிங் தட் யூ ஆர் கோயிங் டு ரைட். அது இட்ஸ் அ காமன் கொஸ்டின். அது எவ்ரி ஒன் ஷுட் நோ. ஒன்ஸ் யூ ஆர் கிராஜுவேட், எவ்ரி ஒன் ஷுட் நோ அப்பர் GI bleed from esophageal varices most commonly. Apart from that, you should be in other way. You should study all the 4 important point and apply your knowledge, except கேட்டாங்கன்னா how you can write, or select all that apply if they're asking how we are write. This is the pattern which last ESIC question paper 1 2 3 4 1 2 3 சேலஞ்சிங்காக இருக்கணும். ஒரு கொஸ்டின் பேப்பரை படிக்கும்போது யூ ஷுட் பி ஒன்ஸ் யூ ஆர் ஸ்டடிங் ஒன் கொஸ்டின், யூ ஹாவ் டு பி சேலஞ்சிங் த கொஸ்டின். அதுதான் வாட் ஐ வில் அட்வைஸ். பிகாஸ் ஆஃப் மை டீச்சிங் எக்ஸ்பீரியன்ஸ் ஆஃப் லாஸ்ட் 10 to 15 years with the clinical background, I will always challenge the questions with the MCQs. So same like you also, my students, old students as well as new, you should challenge your question, each and every questions. ஒரு ஸ்லைட்ல how we can modulate the questions. Okay, so don't memorize. இதான் புக்ஸ்லயும் அதே தான். Even though if you study the books, same. இந்த 4 தான் ஆன்சர். It may be peptic ulcer, it may be gastritis, erosive gastritis, or esophagitis, esophageal varices, or Mallory Weiss syndrome. So this is the 4 causes of the upper GI bleed. And yes, and then come for the lower GI bleed. So same pattern you can frame in the lower GI bleed, and that is also very important. If you think about diverticulosis, Meckel's diverticulum, 2:2:2:2:2, we'll see that. Infectious colitis, I can take very simple subject only in your demo. Okay, IBD, hemorrhoids. Your whole GI system is finished. If you know to compare upper GI bleed and lower GI bleed, if you know to compare upper abdomen pain and lower abdomen pain, your GI system is completed. Upper abdomen pain, gastritis, இதெல்லாம் வரும். Okay, lower abdomen pain, these all will come. IBD, ulcerative colitis, hemorrhoids. So this is what actually you should know to compare. So clearer upper abdomen pain, okay, stomach pain, gastritic pain, gallbladder pain, இதெல்லாம் வந்து it will be there. Many conditions will be studying upper abdomen pain, lower abdomen pain. And same like upper GI bleed and lower GI bleed. So before entering the GI, this complete GI system will be covered if you are good in the upper abdomen pain, lower abdomen pain, and upper GI tract and lower GI tract. So let us discuss what is lower GI bleed. It is less common than the upper GI bleed. ஏன்னா most common வந்து upper GI தான். Because of alcoholic, cirrhosis of liver, esophageal varices, right? Peptic ulcer. One of the most common conditions where it's seen in the lifestyle day-to-day activities. Because of chronic fasting, long fasting in the midnight, morning breakfast skip பண்றது, இதெல்லாம் mostly you get a chance of ulcer, peptic ulcer disease. Morning breakfast skip பண்றவங்க எல்லாருக்குமே they may have erosion. Long time, even nursing field வந்து what we do, morning breakfast, many people will skip. Even we tell, we also skip. But we took any biscuits or any banana, whatever available during our journey, and we can satisfy with the stomach and we enjoy lunch. So அந்த மாதிரி இருக்கும்போது when you go for job also 7 o'clock we are going for duty, mostly morning 6:30 is very difficult to have the breakfast. So when you go and reach the hospital and 10 o'clock the ward will be busy, then 11:30 12 o'clock you'll eat the breakfast, and night you took the dinner around 8 o'clock, and see the duration nearly 14 hours fasting. So அதனால தான் morning usually they tell anything which you have you can eat and go, milk or biscuits or banana, whatever you have. So that is a major cause which you have the peptic ulcer disease. Slowly erosion, and if it is alcoholic men, there is a chance of severe alcoholic cirrhosis, and that may go for GI bleed also. Okay, it's a medical GI medicine model work பண்ணும்போது you can see the cases GI bleed la. So it's less common than the upper GI bleed. Upper GI bleed is most common cause for the bleed in the lower. That is what I said. Most common among the men, yes, because of alcoholic. Increased rate in elderly patients, and majority resolves spontaneously without intervention. Okay, so see, lower GI bleed வந்து நம்ம upper GI bleed வந்து alcoholic இருக்கு. Lower GI bleed வந்து hemorrhoids. Sorry, this is about lower GI bleed. Lower GI bleed is your hemorrhoids, which I said, inflammatory bowel disease because of, and diverticulosis. In the 3 conditions which usually happen for the lower GI bleed. How to examine? So question வந்து எப்படின்னா first வந்து you know the what is GA bleed, classification, division, and you know now clearly what is the cause of the upper GA and lower GA. Now imagine the patient come with severe bleeding. You are the casualty. You see GA bleeding is that. So basically start with your basics. Key points which you put a question there. How many episodes? Yes, how much of blood? Vomiting, if it is there, you can see aspiration chances there. How many episodes and how much blood? Medical history, alcohol, liver disease, any surgery recently. Medication history, இதுதான் வந்து உங்களோட clinical case study, how you have to compare. Those who are in the clinical, NSAID causes G bleeding, and medication links, any chronic use of glucocorticoids, any anticoagulants. So these are the three medication lists we have to give important. I assess the airway, breathing, circulation. Apart from that, how many episodes of vomiting or this is there? You have to confirm how much blood is there. Okay, and medication history, whether medical history, whether they have alcohol abuse or liver disease or surgical history, or you go for medication list, NSAID or glucocorticoids or anticoagulants. So put a question yourself. This all we frame ourselves. And our clinical experience which in the question slides la. Think about yourself. Differential could blood be coming from elsewhere? Nala usually I will think blood is there. Stool blood in the stool is there, and the patient attenders complaint of blood in the stool and GA bleeding. How we confirm? And so we think whether blood comes from somewhere else. Yes, you have to think about whether it may be nasal bleed, whether hemoptysis, or maybe dental bleeding. Okay, or elsewhere. Yes, it may be from anywhere. Once again, hemorrhoids, fissures, and vaginal bleeding could be coming from anywhere else. Yes, it can come. So what is the key word? These are all the key word to know, which you all know that basics. Basics like என்னைக்குமே you never compromise the question in the basics. Hematemesis la questions வந்துச்சுன்னா hematemesis தான் vomiting of dried blood. Vomiting of dark blood and the coffee ground emesis, it's a different. Right? Based on the patient condition, you get four kind of bleeding. Hematemesis, vomiting of bright red. We you may feel, நம்ம usually think பண்றதுனா very simple தானே, hematemesis தானே. Bright red or dark red, பாதி பேர் you lost your questions. It's a bright red. Dark red is old material, is coffee ground emesis, some condition you will be seeing. Melena, dark black starry stools, which you all know that. I think melena everyone knows. So hematemesis, hematochezia is a fresh blood in the stool. Fresh blood in the stool. So yes, maroon blood with stool. So melena caused from the upper GI source, or hematochezia the cause from the lower GI series. Any problem in the lower GI? Any problem? Melina இருந்துச்சுன்னு வச்சுங்களா, இப்போ you are going for the bedding and patient complaint of bleeding suddenly, blood in the stool. So they will call you and they'll this is a practical. They will call you and they will show you, and you are watching that. And what we do immediately, we may go and inform the physician, sir, there is a bleeding in the stool. What kind of bleeding? They will come and assess. That is what I said. Why we not able to assess? You can tell this is the upper GA, lower GA. By seeing the stool, you can tell black color, light, dark red, bright red, active bleeding. So this is what assessment based question are now MCQs. Instead of memorizing the question, instead of directly you are studying the questions, you should know to assess the patients. If you are on the bedside, blood stain is there, blood stool is there. It may be dark blood or it may be bright color. Easily you can tell by seeing, okay, bright red, fresh blood and the kandipa source from the exam question MCQ, source from the lower GA. If it is hematochezia, fresh blood in the stool, it is source from the lower GA. Upper lower GA, you know, diverticulosis, inflammatory bowel disease, இதெல்லாம் வந்து major part in the lower side. Okay. Upper GA esophageal varices, peptic ulcer disease, இதெல்லாம் வந்து from upper GA. So basically, உங்களுக்கு வந்து what is the exact thing in your competitive exam? நீங்க யோசிச்சு, what we think, usually you think. இதெல்லாம் important. If you are in the GA department, any department, patient complaint of stool, you are going to assess and you are going to see bleeding. That bleeding, you should find out whether it's a whole black tariff color, black color, or it's a fresh blood, maroon color. So then you can decide, sir, it's a fresh blood. It may be sourced from the lower GI, it may be upper GI source. So upper GI and cause, you know that, now you studied. So this is what actually question also will come. Okay, so important test what we do before going for GI. If GI bleeding, see, if patients having severe anemia, how they want to do the GI bleeding. If GI bleeding find out, if they want to do where the GI bleed, most common investigations, they go for GIAC test. So it's one of the most important repeated question you are not said. GIAC test is used to assess GI bleeding. Okay, GI bleeding. Gloves, wear the gloves, they will do, and they will insert the finger. Okay, so insert the finger and they will find out whether blood in the GIAC test, blood in the gloves, stain, blood stain. They will find out blood stain. General surgeon, usually gastro surgeon, they will do it as assessing the patients. Apart from that, CBC, they will check out hemoglobin. Hematocrit is very important. Both they will be checking, and coagulation test they will be doing, because maybe coagulation patient known case of any oral anticoagulant they take, bleeding will be there. Cross matching surely they will do, and LFT, all the investigations though you will do. But MCQ is this one. Mostly MCQs from your exactly the most common stool GIAC test. GIAC test is used to assess the GI bleeding. Okay, peptic ulcer disease when they insert the gloves and they'll check whether blood stain in the fingers, and they confirm that there is a bleeding internally. Okay, they have to rule out why the bleeding is there. Okay, so this is the major test which they will do. And what value in the biochemistry panel can give vital information on the patient GI bleeding? MCQ. Now, CBC may get all the information, but what is the most important information is burn. So option A, BUN. Option 2, they may give anything, lipid profile, anything. Option C, coagulation profile, or anything, whatever chemistry profile. The biochemistry profile is, biochemistry profile, CBC, LFT, KFT, burn. Burn is always important. It's a vital information of the GI bleeding. Why? The burn test becomes increased more with the upper GI bleed. That is a question which you should know practically, and it represents the digestion, absorption of the hemoglobin. That is the reason why you get burn is elevated, because patient having bleeding and there is a decrease anemia, HB will be decreased, and that is the reason why it absorption of hemoglobin to find out. If it is increased, it's very difficult the hemoglobin getting absorbed. Okay, so that's the reason why the vital information of the GI bleeding patients, which biochemistry panel is very important. It's all clinical. Okay, generalize you may get suffer in your question. This little advanced level. I start from the basic. Now I'm entering this all little advanced. Okay, so burn investigation, urea nitrogen is very important. Blood urea nitrogen is very important for the biochemistry panel. Now the question: imagine that NG tube lavage, give or not to give. Kunjana, little chapter. This is very simple. Whether GI bleeding patients can NG tube, yes, no longer recommended. It's no longer recommended for the diagnosis of the upper GI bleed. India question frame your MCQ. Practically, you think no longer recommended for the upper GI bleed. Yes, because it causes compression. Once again, bleeding. So no NG tube insertion no longer. How you give the lavage? Only any abdominal intraperitoneal, any peritoneal, intraperitoneal small bleed or anything is there. Lavage usually we give blood in the stomach, ultrasound we give lavage. But when you give the upper GI bleed, source from the esophagus, mostly major source from the esophagus. So NG tube insertion no longer recommended for the diagnosis of the upper GI bleed. So lavage நீங்க கொடுப்பீங்களா கொடுக்க மாட்டீங்களா? Why not to give NG lavage? When you are not putting NG tube, how you are going to give NG lavage? But mostly intraperitoneal bleed, usually they go for lavage, small bleed. They'll check out any abdominal distension, upper GI bleed, anything hematuria, anything which suspected in the ultrasound, they can go for abdominal distension irundhuchna polam. But same time, when the source is the upper GI bleed, you should never try this one. Reason is patient may be having severe bleeding, painful procedure. There's chance of risk of aspiration, and chance of getting pneumothorax, and chance of getting perforation. இதுதான் ரொம்ப important MCQs. Either you should know See, two scenarios. GA bleed is there. There's no point of putting the NG tube. You know that GA bleeding, clearly GA bleeding, bleed complete aspiration, mouth full of bleeding is coming, and the GA bleed full of, you know, the GA bleed patient, if you see, you can come to know. There's no point of putting the NG tube. But when there is intraperitoneal ATLS பார்க்கும்போது intraperitoneal rupture, intraperitoneal இருந்து ஏதாவது acute abdomen, some conditions are there where you get small bleed in the abdomen. So doctors ultrasound பார்க்கும்போது they will check abdominal distension will be there. Gastric decompression they can do, or NG lavage they can check it whether if NG lavage if they put NG tube when the blood is there, then they go to lavage. That is the scenario is different. Okay, therapeutic purpose we are doing. This is a bleeding, compulsory patient bleeding is there. It is not recommended to put NG tube in the patients with GA bleed. Okay, so this is very clear, and moreover the complications. So it's a painful procedure during the bleeding and risk of aspiration, pneumothorax and perforation. So what kind of imaging? Yes, what kind of imaging? Yes, if it is perforation, mostly GA bleeding perforation. Yes, if the perforations happen, what is the most important investigation the nurse will send? CT scan. Yes, if it is lower GA bleed, consider angiography. See, inge clear இருக்கு. There is no compromise the questions. Upper GA bleed or perforation இருக்குன்னா CT scan to evaluate for this. If the problem is a lower GA bleed, you can go for angiography and scintigraphy. So angiography is benefit than the scintigraphy for the embolizations also. So we will see that what is you do in the embolization. Angiography, I'll put a question also in this. So angiography is most commonly they go for this lower GA bleed. Okay. So here, what medication can help? So upper GA bleed, இங்க பாருங்க இதுலயும் question இருக்கு. Omeprazole, varicose, upper GA bleed general I'm giving you. If it is esophageal varicose bleed, that medication choice, octreotide is a good choice, is safer medication. Infusion usually we give. This is very important. Somatostatin we give if safer side cardiac patients are randa. If it is safer side, they are going with the safer side. So octreotide தான் வந்து safer medication which helps in the varicose esophageal varices. And somatostatin, those who are working in the GE department, they may be knowing somatostatin usually we give fine, but it is not safer. GE heart arrhythmias prevent பண்றதுக்கு it's better go for the octreotide. It's a safer drug. Cirrhotic patients, compulsory, even if it is medications, antibiotics very important. Start immediately antibiotic prophylactic dosage, and gastric motility agents also we can use for some condition. If the condition is gastric motility agents, if you want to give, so we can go for erythromycin or metoclopramide. So one of the most important, which is the most important gastric motility agent question vanduchina, so we can take it's a metoclopramide. Okay. So overall, you should know, just for superficially, still we have a lot of conditions in the GA system. Or GA bleed patients on the how you manage, what is the medications, what generally. Okay, medications may give upper GA bleed na omeprazole, varicose bleed na octreotide, cirrhotic patients ciprofloxacin, it's better choice you give, and then we manage. Gastric motility agents, better choice is metoclopramide, which usually we give. Okay, that will also good to prevent vomiting and everything. Okay. See, other intervention, example வருது என்னன்னா, what intervention with GA bleed we do? First intervention, endoscope. Suspected case of GA bleed, there is no way endoscopy is there. First intervention they will find out, because without endoscopy it's very difficult to rule out the condition. Within 24 hours they have to go for the endoscopy. Exam question. So this is what MCQ, the first point. And if the confirmation bleeding is done, then if cirrhosis of liver or if esophageal varices is confirmed, then they can go for sense-taken Blackmore tube, which will be studying in gastro little deeper. Here balloon tamponade, same. Sense-taken Blackmore tube is a balloon tamponade procedure they will do for the, especially for the if GA bleed is esophageal varices, mostly upper GA bleed. Then if needed, they go for surgical management. If bleeding does not stop without measures, they'll go for surgical management. Overall, வந்து பார்க்கும்போது ஒரு GA bleed patients are suspected. If you are receiving the GA bleed patients, what you do immediately? You do immediately they advise for the endoscopy, and then they go for the tamponade if it is especially for esophageal varices. I'm focusing only esophageal varices, major condition because of alcoholic condition. Okay. So what you first prepare the patients for endoscopy, then plan for the this one, posted for the sense-taken black motif balloon tamponade. Okay, so இது வந்து யூஷுவலா this is what actually we usually consider. This is a small content தான், ரொம்பலாம் எடுக்கல. பேசிக்கலா உங்களுக்கு கிளாரிட்டி இருக்கணும் எப்படி ப்ரிப்பேர் பண்ணணும் எக்ஸாமுக்குன்னு. ஓகே, ஸோ ஒரு கேஸ் ஸ்டடியில் யூ ஹாவ் a patient with emergency department concern of 2 days black stool. Apana patients, you said, now you think I'm focusing. Why I'm focusing esophageal varices? The scenario is 2 days of black stool. The 2 days of black stool source from the upper GI. That maybe I'm focusing the this one, esophageal varices. So warrior case study we have discussed all clarity upper GI bleed, lower GI, and then what is the cause of upper GI, what is the cause of lower GI, and lower GI cause on the upper GI, how to examine the this one with proper examination, airway, breathing, circulations, which all the medication causes bleeding, what is the medical history you assess, what is the key histological point, how much of episode they had bleeding, and how much blood it is lost. Okay, so blood viral blood can leak from the body, nasal bleed, hemoptysis, dental bleeding also will be there, hemorrhoids also will bleed, anal fissures also bleed, and vaginal bleeding also will be there, abruptia placenta, placenta pria, which you studied. And keywords exam question la vandu hematemesis, coffee ground emesis la vandu you should know, peptic ulcer disease or vomiting of dark material only, coffee ground emesis, upper GI source. Melina also upper GI source, and hematochezia from the lower GI bleeding. So idhiliye ungalku MCQs, if they want to plan for GI bleeding, one of the most important topic, so you get a question, and based on that investigation, stool GAC test which they do, and then along that blood investigation, hematocrit is very important. Why it is important? Sorry, burn is important. Why it is important? It represents digestion and absorption of the hemoglobin. Okay, so NG tube lavage, bleeding is there, whether you give the NG tube lavage or not. Update or questions you can frame. When the bleeding is there, no lavage, no NG tube insertion. Plan for endoscopy, and then plan for the this one, balloon tamponade. It's because of painful procedure, risk of aspiration, pneumothorax, and perforation. ஸோ இதெல்லாம் ரொம்ப இம்பார்ட்டன்ட். கீ பாயிண்ட்ஸ் என்னன்னா, ஒரு ப்ளீடிங் ஜியில் அப்பர் ஜியில் வரும்போது ரெஜிஸ்டர் போடணுமா, இதெல்லாம் ப்ராக்டிக்கலாக வந்து இட் இஸ் நாட் விச் இஸ் நாட் இந்த புக்கில் இருந்தாலும், பட் ப்ராக்டிக்கலி வென் யூ ஒர்க் இன் த டிபார்ட்மெண்ட் சைட், you can compare with this. Okay, this is what we did actually. Many people may feel, okay, this we did in the clinical, GI bleed patient came, we didn't put. அதுதான் வந்து question. That is what your correlation. Usually correlating and studying is always best, which you all know that. Usually I will teach from the clinical only. I'll go directly, not the theory. I'll teach from the clinical. Let us have a small discussion about questions, because this is the pattern how you are going to study in the short-term course as well as your upcoming AIIMS NORCET. அதாவது ஷார்ட் டேர்ம் கோர்ஸ் வந்து வரும்போது we all become fire because of good result. அந்த 35 days plus 35 daysல வந்து you will the track whatever we are discussing, we are going to give MCQ. நான் வந்து இப்போ 10 MCQ கொடுத்துருக்கேன், only small topic. You are going to give the answer. 6-year-old male presents with hematemesis and hypotension. He has a history of alcohol use disorder. Which condition is most likely to cause symptom, and what immediate interventions should the nurse prioritize? It's a question from the topic. Question from the topic. Yes. So people are giving answer B. So since we discussed alcohol use disorder, directly pre-test இருந்தா கன்ஃபியூஸ்ட் ஆயிருப்பீங்க. போஸ்ட் டெஸ்டா இருக்கு, it will be easy. I don't want to go pre-test because of the time which they delayed. So I think many people have given the right answer, because it is alcohol use disorder, hematemesis and hypotension is there. So immediately esophageal varices. What do you do immediately? It is we have to initiate IV fluids because patients going for severe hypotension, and prepare the patients for endoscopy. இதுலயே உங்களோட questions clear. You don't want to study. Practically using esophageal varices, okay, bleeding is there, hypotension is there, IV fluids start பண்ணிட்டு. So better plan for the prepare for patients for endoscopy. Okay, within 24 hours. Patient reports bright red blood per rectum and denies any pain. What is the likely cause, and diagnostic test should be prioritized? and denies any pain. People are giving, see, bright red blood stool per rectum, and there is denies any pain. What is the likely cause and what diagnosis be prioritized? Denies the pain. Prasid Krishna, Prasid Rajana is giving A. So let us see the answers. Answer is A, right? So what is the special here? Without pain, I want to tell hemorrhoids there will be pain. Upper GA plane will be there. Anal fissure will be pain. So that's a key point which you have to note here. Even though everything have the bright red blood, but without pain is often indicative of diverticulosis. இதுதான் வந்து diverticulosis right side. Usually வந்து appendicitis will come in the usually which side? Right side, right? Appendix. Left side appendicitis is known as diverticulitis. Left side வரும். Okay. So hemorrhoids, yes, denies without pain is often indicative of diverticulosis. So colonoscopy is a diagnostic choice. Is a lower. Even upper GA bleed okay tha, but pain. Okay, without pain is often indicative of diverticulosis. Okay, fine. Patient with suspected upper GA bleed have high burn. What does it finding suggest? You பாருங்க content we studied from that only I given the question. So you get a confident. So I hope everyone can answer. Yes, good. And the content படிக்கப்போ you studied and now you are answering. Good. Upper GA bleed is very important and high burn is always suggests which finding. Okay, so GA bleeding. Patient is undergoing endoscopy for GA bleeding. What is the pre-procedural preparation should the nurse prioritize? Okay, good. So this is a basic. This is a basic question. Basically, no one can do the mistake. That is what I given the basic question. Endoscopy பண்ணும்போது, what do you do? Ensuring the patient's NPO and establish IV access. Okay. Don't give C and don't give unnecessarily because patient you are preparing endoscopy. அப்பனா patient NPO plus establishing IV access. 50-year-old male with a history of NSAID use with melena. So peptic ulcer disease give IV proton pump. Melina, what is it like? A. B or other. Why NSAID cause of the lower G we have studied here. Yes, we have studied upper G bleed வந்து esophageal varices இருக்கு peptic ulcer is. But melena வந்து prominent features of which condition? அதுதான் special here. So I put a question here. When you are checking the GA bleed, medication lists NSAID glucoanticoagulants. கொஞ்சம் கன்ஃபியூஷன் தான் பட் theoretically if you see melena prominently seen in upper GA bleed, especially in esophageal varices. In a slower esophagus, it starts bleed slowly. Okay. Peptic ulcer வந்து erosion இருக்கும். But chronic stage தான் it get bleed. Usually peptic ulcer won't get bleed. அதுதான் you should be very clear. Erosion will be there. At chronic, if you are not treated, then it's fine. But the condition is is a clinical condition. The condition is they've given male history of chronic use of NSAID use present to melena. What is the likely diagnosis initial intervention? Yes, even though we know that NSAID usage causes peptic ulcer disease. In the peptic ulcer disease, we have clarity. Duodenal ulcer is there. Yes. Which ulcer is most commonly seen? H. pylori infection, duodenal ulcer, gastric ulcer. So there is no clarity. Gastric ulcer is also there. Gastritis. So gastritis, chronic NSAID use also causes gastritis. But inge vandu melena is a key features. It's very important. Okay. So esophageal varices, I think answer will be A. Acha, sorry. Yeah, you are right. Sorry, I only given melena. Sorry, I only given esophageal varices. I was thinking esophageal varices. You are right. Peptic ulcer disease. Melena is a patient with history of just a minute. Yes. Yes. Suggestive of NSAID use strongly suggests peptic ulcer disease. Yes, esophageal varices maybe I may be wrong because I thought it may be all question from the GI bleed, upper GI, sorry, esophageal varices. Okay. So here, since it is given NSAID, but we have seen upper GI bleed causes always it's your peptic ulcer disease as well as esophageal varices. So based on that, they've given. But melena, even if it is come for here, sorry, just a minute. Yes, you are right. Okay. So history of NSAID use presence in melena. What is the diagnosis and initial intervention? Peptic ulcer disease. Proton pump. What is the proton pump inhibitors which we use? We use pantoprazole. Yes. Continuously we give pantoprazole. Okay. It's the first line of choice to reduce the gastric acid and promote. Yes. Pantacid infusion also will start. Okay. Patient present with sign of shock and profuse hematochezia. Hematochezia, fresh blood. Fresh blood in the stool. This only. This is the question I want to take. Hematochezia. Okay, fine. What is the priority nursing intervention? Yes. B. You're right? Or yes. Good. So profuse hematochezia, bright red, sign of shock is there. So you are immediately going with IV fluids and blood products as needed because of lower GI bleeding, right? And stabilizing the patient with IV fluid and transfusion is critical. Okay. So இதெல்லாம் basic தான். So this in the previous question I was thinking some other physiology and explaining, but you are right. In previous physiology, even cause of upper GI, we have peptic ulcer as well as esophageal varices. So melena priority here both esophageal variceல இருக்கும் peptic ulcerல இருக்கும். But இங்க NSAID use usually peptic ulcer disease they have not given any age they've given 50 years they've given, so that may be the reason. Young stage and it won't get bleed based on the patient's usage. Okay. What imaging modality is most likely to for identifying site of lower GI bleed? C and D option is there. Lower GI bill priority. Just now we studied from the slide. Some people are giving C, some people are giving A. So there is a key point which we have discussed here. Intervention angiography goes for the benefit of treatment of embolization. So based on that, if you check, answer is yes. Lower GI stable patients. Key point பாருங்க stable. அங்க பாருங்க I am also following your answer. Since you all given A and C, yes. Yeah, stable patients lower GI bleed. So most useful ideal site for the lower G bleed. Initial first intervention, preferred diagnostic tool is colonoscopy. Usually colonoscopy will send the patient, stable patient இருந்தா, then we'll find out one by one all the investigation. Okay. So இதுலயே வந்து ஒரு key points they kept stable patients. இது collapse, ரொம்ப severe bleeding, esophageal varices they give. Then we think about angiography. Okay. So here just they were asking which imaging modality is most useful for the identifying site of the colonoscopy, sorry, GA bleed in the stable patients. We plan the patients to prepare for the colonoscopy, CT angiography also they do. But initially colonoscopy they do prefer diagnostic tool for identifying the source of the lower GA in the stable patients. Okay. So இதெல்லாம் வந்து little complicated தான். So when you are in the practical, sometimes we lose the concentration, we do the mistake. So even I also do the mistake. But here concentration is important. Patient with hematemesis found to have medullary this tear, esophageal tear. அதுதான் இதுதான் esophageal tear. So what is the initial esophageal tear? Na வந்து mostly it may be your what kind of option you get. Initial management step. Initially, what we do? Prefer for emergency. It's emergency condition. Yes, it's emergency condition. Perform the NG tube lavage. Very simply, yes. Malarial VSTS often resolves spontaneously initial stage. So initial management involves stabilizing the patient with fluid, controlling nausea to prevent further vomiting. Okay. So initially, without idea, we do the mistake. Initial phase la வந்து first phase initial see question la வந்து என்னன்னா they are asking initial management. Initially வந்து you do this and then further they'll go for all the management. Okay. Step by step. Patient diagnosis esophageal varices and schedule for balloon tamponade. What complications should the nurse monitor for? So this is a direct question. Like, yes. B, A, A, C. All the complications. Aspiration, pneumonia, aspiration. Key point. Sepsis later stage la varum. Elderly known aspiration, pneumonia. It will take. Initially, it go for me. It's a yes. It's a tube perforation. So, which is the fourth thing complicated slide la now படிச்சது. Perforation complication வந்து painful risk of aspiration perforation. But question la வந்து what they're asking. இது போல A and B also they can give. But generally in the questions they given. Sorry. Oh, sorry. Just a minute. Yes. Patient diagnosed esophageal varices and scheduled for balloon tamponade. Which complications should the nurse monitor for? So tube perforations require careful monitoring. Major complication we have to give important compared to minor because that is a big procedure which they are inserting. So as per the book picture, you get answer C directly because chance of getting perforation. So we have to be very careful in the monitoring. Okay. Patient GA bleed prescribed angiography. What is the primary advantage of this procedure? It is in the book. Yeah, it is in the content. So you can give the right answer, I think. Yes, angiography not only identifies the site of bleeding along with the colonoscopy, second stage. CT angiography, usually on the CT angiography, we do angiography next of the colonoscopy. And site of bleeding, but as always allows the treatment via embolizations. Make it both diagnostic and therapeutic procedure. Yes. Okay, so this is usually it happens. Sorry. Okay. Treatment with embolization. So in the 10 questions one day, I just given you which is very important for your exam. Okay. Based on the your content. So based on your content, today what we studied, இன்னும் கூட கொடுக்கலாம். Maybe still we can frame another 15 question also based on this lavage கொடுக்கக்கூடாது. So it is up to the pattern. So ஒரு content போது maybe esophageal varices is important topics. Peptic ulcer disease also important topic. J ல வந்து peptic ulcer, esophageal varices. H pylori positive na duodenal ulcer that will be studying. Okay. Duodenal ulcer தான் mostly H pylori infection. Okay. So this is what actually for new students, this is the pattern which you have to go with the studies continuously. Or idea இருக்கும். Clarity will be there, and most probably if you have doubts, questions, revisions இருக்கும்போது you can correct your mistake. So in the content இதுதான் answer, இதுதான் question, இதுதான் answer. So in the pattern போகும்போது last time we had this pattern, so we got a good success. So what are topics? Day first day topic ல இருந்து ஒரு questions, second day topic ல இருந்து questions. So we can discuss so that 35 days ல வந்து you can have good knowledge, as I said. Okay. So any doubt you can ask. So I just formed today's simple topic only. So okay, for the new students, so see the previous recording about we given the plan, schedule, study plan. Okay, join in our WhatsApp group. So updation and everything will be there in the link which is given in the description. Okay. So this is a pattern also we have explained. Once again, it's very difficult to explain. Already recorded session we have given. So what kind of questions, how to prepare, study plan, everything we given. Okay. Hope this session may little useful, that maybe you may get கொஞ்சம் யூஸ்ஃபுல்லா இருந்திருக்கும். எப்படி உங்களுக்கு ஐடென்டிஃபை பண்ணி how you are going to study. New students இருக்கீங்களா? Any new student? So this is where how you have to prepare. Basically, this is the basic standard preparation. கொஞ்சம் டீப்பாவும் போகலாம். Still we can go deeper, like 15-20 questions additionally we can add. At least you can get an idea. Okay, இதுதான் காம்படிட்டிவ் எக்ஸாம், இப்படிதான் படிக்கணும். இல்லைன்னா நீங்க என்ன பண்ணீங்க, டெஃபினிஷன், சைன்ஸ் அண்ட் சிம்டம்ஸ், அசஸ்மெண்ட், இந்த மாதிரி ஒரு டிஃப்ரெண்டா யூ வில் பி ஸ்டடிங் வாட் இஸ் கிவன் த புக். You are studying, you have to correlate. Correlation வந்து it won't come before. Since I have 20 years of clinical experience, so I can correlate. Because உங்களுக்கு வந்து இந்த correlation வராது initially, because you are not exposed to the clinical. You have to learn from someone, or you have to work in the clinical. Two options you have. Okay, clinical work பண்ணும்போதே you can correlate. That will be have more positive in your exam. Those who are in the bedside ICU, CCU, gastro department இருக்கவங்கலாம் ரொம்ப யூஸ்ஃபுல்லா இருக்கும். எந்த டிபார்ட்மெண்ட் தான் அந்த கண்டிஷன் வாட் எவர் யூ ஸ்டடிங், யூ கேன் கோரிலேட் இன் தட் கண்டிஷன் when you are going to the bedside. So easily it is very important to grasp. Okay. So anything else if you want to ask, you can ask. So this is the demo which I given today's plan. Okay. So so Monday sessions will start as per the schedule. So first session from the Monday. Yes, I think Monday 20. Okay. Yes, I'm starting with the fundamental, fast, very fast, and then med-surg 4 days, and then child health, and then infection control, then biochemistry, social nutrition, OBG, and then once again med-surg, aptitude reasoning, then mental health nursing, med-surg and mental health nursing, and then OBG, community health nursing, then GK, current affairs, research management, and computers, Grand 1 mock test, Grand 2 mock test. Side may you get 15 mock tests as per the some ideas of CRE exam. Okay. So thank you all. So if you have any doubt, you can comment in that comment box, so that if it is anything wrong, we can clarify. Okay. Thank you so much for joining the demo session. So demo session வந்து இதுதான் பேசிக்கலா உங்களுக்கு ஒரு ஐடியா கொடுக்க தான் demo session. Baaki remaining all will be in the session only fully. Okay. Thank you so much. So many people are not aware of demo session, so I given the demo. Okay. So thank you all. Thank you all.